Hi, this is Scott Shepard, and I'm Ron Miller of Pursuit Physical Therapy. And today we're going to answer the question, can you return to golf after getting a total hip replacement? So nowadays we're seeing so many people getting total hips after hip osteoarthritis or some sort of injury. But the real question is, can someone who had a total hip replacement return to golf?
And the answer to that is definitely yes. The reason why you're having a joint replacement, aside from getting rid of the pain that you're having, is to restore your function in your life, get you back to more normal living. So if golf is one of your activities, which is also a very low impact activity, relatively speaking, that's an activity you can definitely return to after having a joint replacement, after you've been released by your doctor and gone through the proper rehabilitation.
Correct. I always hate it when medical professionals say, no, just stop doing this. Mm-hmm. Stop doing your favorite activity. Stop golfing, stop CrossFit, stop running. And I believe that you also believe the same thing here, is that if you address everything thoroughly, solve the root cause, mm-hmm. identify risk factors, that there's no reason why you can't get back to golf. We've had multiple patients this year have total hip replacements, whether it's a posterior or anterior approach, it really doesn't matter, but we've had multiple patients return to golf on a structured program. So yes, I totally agree with you on that one. Mm-hmm. So how about when does someone know when they can return to golf, or at least start swinging or practicing putting or swinging some or doing some chipping, and then eventually returning to driving and playing 18 holes? So when would someone know when they can start returning to golf?
Well, the first thing is you got to defer back to the orthopedic surgeon who did the procedure because they understand the dynamics of the procedure, what type of components they used in the replacement, what they anticipate on the healing of it, and they're going to have their set number of weeks where they'll say, nothing for this long, and after that you're okay to return to it. But that's usually just an arbitrary date, and they'll say, okay, 8 weeks and you can return to this. But at that point, you still don't really know whether you can actually do the activity just because the time has passed. So that's why it's important to get evaluated by a physical therapist who understands the golf swing and can tell you, hey, here's how your movement is, and you're ready for this phase or this phase, so that you just don't go back to full swinging drivers when you're not ready and your body is going to get re-injured or slow down the healing.
Yeah. Is there a certain timeline at all that is generally accepted in the medical profession, like after total hips, then like eight or 6 months? Have you heard of anything?
I mean, I've heard everything from different surgeons. I think some people are more aggressive and they'll put you in a range where they'll let you start chipping and putting within 8 to 10 weeks. Other people are more like, oh, we don't want you to do anything for 4 months. So it really goes back to that question to the orthopedic surgeon. You got to ask them first, and when they clear you, then you need to know, well, actually, can I do it? Just because I've been cleared doesn't mean I can actually do it physically.
Good. It's important, and that means that there is no just general guideline. It's based off of your case.
Yep.
So if you do everything right, you may get back to swinging and chipping maybe in 2 months. But then if it's more complex, you had some problems with it, maybe it might be 6 months. So the important thing is that it's up to your case, and when you're truly evaluated, then we can guide you on a structured program to get you back to swinging. So some may be 2 months, some may be 8. So it's a case-by-case basis. So the last question that many of people have is how? Is there anything out there are there programs out there that will help people with total hip replacements get back to golf? What's the best way to do it?
Yeah.
And is there anything out there that will help them get back to golf?
Yeah, and I think we're in that age of programs. So if you go on YouTube, you can find, return to golf program after hip replacement. And the dangerous thing about any of that is that's a general program. That's covering only general things. It doesn't take into account your specific circumstances, and it only takes into account the hip usually. It doesn't look at the total body, how the other parts move, and how that could affect you. It doesn't look at your golf swing. It doesn't talk to your golf coach to consider the elements of your swing that are important for that golf coach and their particular philosophy. So that's why it's really important you go meet with somebody who can show you what to do, can talk to your swing coach or your orthopedic surgeon and say, hey, here's what they need to do physically to attain this specific movement, and here's where they are, and here's a plan to get them better to where they can fully return without injuring themselves back to full function in golf or whatever your activity is.
Great, perfect. So, there is just general programs out there, but if you want a customized program that's specific for your case and your wants and needs, you can give us a call. Scott runs our golf performance and injury program here at Pursuit Physical Therapy, and we can get you in for a thorough evaluation, address all of the factors, align your goals, and make sure that you're on a set customized program to get you back to golf after your total hip replacement. So if you've had a total hip replacement and you're ready and wanting to get back to golf, or if you're not golfing yet or you're struggling to get back to golf, give us a call today at 407-494-8835. If you want some more info about this, you can visit our website at pursuittherapy.com and click on the golf injury and performance program. So thanks for taking time out of your day to answer the questions. We hope that you learned something from this, and we hope to hear from you soon. Thanks.